Hey all, so this is a short podcast on the chest x-ray that I posted earlier. And this was an elderly lady that came in very short of breath, could only speak one word at a time, hypoxic. And turns out she had a pretty significant right-sided pleural effusion, as you can see here. So let's start with the beginning here, A for airway. You can see the airway coming down here. See it branching right here. That's a carina right there. So if you wanted to have an ET tube, you'd want it to be anywhere from 3, 4, 5 centimeters above that area. B for bones, all her bones are fine. C for cardiac silhouette, yeah, well, good luck with that. So you can't see any silhouette on the patient's right side. And the left side looks like this is part of the cardiac silhouette there. You can see here aorta is very pronounced. And she did have that on an old chest x-ray because that was obviously concerning. Get rid of that line now, make room. So D for diaphragms, we'll go to the patient's left side, and here is her left diaphragm right here. You can see this costophrenic angle is blunted. She has a little pleural effusion on the left side there. The right side, yeah, well, good luck with that. You may be able to see a little piece of the diaphragm there. But all this is fluid. She has a large pleural effusion. All this is fluid in here. And of course I put the ultrasound on because I ultrasound every patient that comes in with dyspnea, and her lung was just free floating in all the fluid. And at that point I did this was at 3:30 in the morning, oh joy. And I hadn't seen a patient that I do thoracentesis on in 6 months, and all of a sudden I get 2 in 2 days. So I'm waiting for the third one. In any case, so 3:30 in the morning I'm doing a thoracentesis, a palliative thoracentesis on this lady. And ended up taking 1100. I could have kept going, but I didn't want to overdo it and cause more issues for her. So I stopped at 1100. And repeat chest x-ray showed a little bit of improvement, but she still probably has another liter at least in there. And obviously I'm way out in the boonies, a little tiny hospital. So this morning I called and consulted with pulmonology at one of the bigger places. They're really good about that. And the pulmonologist was very helpful. And of course I'd already sent off all the various lab tests on the pleural fluid, which won't be back for a few days since we have to send them out. But a lady was just 1,000% better and able to breathe and talk and even walk, and her SATs are up. She was dropping at 84% before anytime she'd walk. And so she'll be following up in the clinic, and along with the consult with pulmonology, and she'll return if she needs to, but I imagine she'll probably be okay for a week or two and see if they can figure out what's causing that. She does have a history of chronic renal disease as well as breast cancer, so either of those could be causing it. I did ultrasound her heart, and it looked pretty hypodynamic. I estimated her ejection fraction 30-35%. Mitral valve opening maybe halfway. I didn't do an EPSS because all I have is a butterfly here, and anybody that uses a butterfly knows just how difficult it is getting a decent cardiac view. And made matters worse, at least mine's a second generation, but I used theirs, which is a first generation. So I didn't save it like I normally do on mine, so I don't have that ultrasound. So anyway, this is a really nice pleural effusion, and hope you all enjoyed it, and I'll see you with the next one.